Hello, we are from Group 5. This video will explain about how respiratory system change due to aging. Age-related changes to the upper and lower respiratory systems can impact respiratory function and lead to various complications. Here are some of the key changes and potential complications associated with aging. This video will explain about the changes in upper and lower respiratory system and the complications of the changes. The first change that may occur is decreasing in sense of smell and taste. With age, there is a gradual decline in the sensitivity of the olfactory system, leading to a reduced sense of smell and taste. Second changes is changes in the larynx and vocal cords. The larynx and vocal cord may undergo age-related changes, resulting in changes in voice quality and increased risk of voice disorders. The last one is increasing risk of upper respiratory infections. Aging can weaken the immune system, making older individuals more susceptible to upper respiratory infections like the common cough and flu.
Age-related changes to lower respiratory system. There are three main changes to the lower respiratory, which are reduced lung elasticity, decreased chest wall compliance, and weakening of respiratory muscles. The first one is reduced lung elasticity. So, what is the impact of reduced lung elasticity to breathing? When lung tissue becomes less elastic, making it more difficult to exhale and leading to reduced lung capacity. The second changes to lower respiratory system is decreased chest wall compliance. When the chest wall becomes stiffer, it can affect the ability to take deep breaths and adequately oxygenate the body. Weakening of the respiratory muscles is the third changes to the lower respiratory system. How does the respiratory muscle weaken? It is because the respiratory muscle became atrophic that can affect the strength of the muscles involved in breathing, such as the diaphragm, leading to decreased respiratory efficiency.
Lastly, the changes to the upper and lower respiratory systems related to aging brought various complications. First, the difficulty clearing mucus due to the age-related changes in the respiratory system can impair the ability to clear mucus from the airways, which may lead to increased vulnerability to infections and, more severely, airway obstruction. Next, the effects of aging on the respiratory system significantly contribute to oxygenation issues caused by the reduction of lung function and efficiency, which may result in lower oxygen levels in the blood, potentially leading to oxygen therapy or respiratory distress. Furthermore, old people are potentially at risk of pneumonia due to decreased cough reflexes and weakened respiratory muscles, which increase the risk of aspirating food or fluids into the lung. They are also vulnerable to chronic respiratory diseases. This is because older adults are more susceptible to chronic respiratory conditions like chronic obstructive pulmonary disease, COPD, and asthma, due to age-associated changes in the structure and function of the lungs, which may increase their pathogenic susceptibility to COPD or asthma.